All right, our next speaker this morning is Ashley Batjer, who entered Oakridge as a 6th grader.
Hi, my name is Ashley, and today I will be talking about oncology. Now, what is oncology? Oncology is the study of cancer, and medical professionals who deal with cancer are referred to as oncologists. So, many of you might be thinking, well, they deal with cancer, but what exactly do they do for their cancer patients? Well, many oncologists will deal with the diagnosis of their patient, surgery, therapies such as chemotherapy and radiation therapy, and they will also deal with the follow-up of their patients after successful treatments and palliative care. Now, what are some diagnostic methods? Some would be biopsies, endoscopies, x-rays, CT scanning, PET scanning, MRI scanning, ultrasounds, scintigraphies, and blood tests. A lot of these methods are also used to determine whether a cancer can be partially removed or removed wholly. Biopsies are medical tests commonly performed by a surgeon involving the sampling of cells or tissues. It is usually the removal of tissue from a living subject to determine the presence or extent of a disease. An endoscopy involves examining the inside of a person's body using an endoscope. An endoscope is a medical device consisting of a long, thin tube with a light and a video camera. It's usually minimally invasive for the patient. And it's usually used to examine surfaces of an organ or tissue. PET and CT scanning images are combined to show biochemical activity in the body. Now, therapies for cancer. While there is an endless list of therapies that many patients use for their cancer treatments, I would like to tell you about 2 common therapies: chemotherapy and radiation therapy. Chemotherapy is used to kill abnormal cells that are constantly dividing, but because the drugs are not specific to the cancer cells, they also end up killing normal healthy cells as well. Radiation therapy uses high energy particles and waves to destroy or damage cancer cells. Now, for most common cancers in the U.S. for men, women, and children. Women, it is usually breast cancer, men, prostate cancer, and for children, it's usually lymphoma, leukemia, and brain tumors. Now, the reason why I wanted to talk to all of you today about oncology is because I want to be an oncologist one day. When did I decide that I wanted to become an oncologist? Well, I can tell you that was probably around 7th grade. I can't explain exactly why, but I can explain what prompted me to. When I was in the 4th grade, my father was diagnosed with esophageal cancer. That's cancer within your throat. After his surgery, he could only eat very soft foods and had to use a feeding tube that was directly connected to his stomach. Now, when my parents told me, I was only about 9, and they told me they didn't want me to look anything up about it, but I did, because I had to know. They weren't mad. They actually ended up buying me a human body book for kids. And I took that thing with me everywhere. As I grew older, though, I realized how serious his illness was and how dangerous it was becoming. He did multiple treatments, and they worked for a while, but eventually his cancer came back every time. He ended up having 32 surgeries over the span of 4 years. It was very hard on my mother. My mother would spend nights at the hospital and take care of me and my sister. It eventually spread to his brain, and in his last surgery, the doctors accidentally cut into the tumor instead of around it. Later, he went on to hospice in December 2008 and passed on December 20th, 2008. Although my father's death was very heartbreaking, I now knew what I wanted to do. My father lived for 4 years after his diagnosis, and if it wasn't for his persistence, perseverance, and help of some oncologists, he wouldn't have gotten that far, and I wouldn't have gone all those years with him. And I think the reason why I'm so passionate about this subject is just because I want to be able to help other people to pursue their goals in their fights against cancer as well. Thank you.